Hello, and welcome back to Saturday Recovery with Dr. Nolan of Midwest Movement Elkhorn. I'm Chris Bober, your host from the Bober Academy, where our mission is to train and develop superior linemen to dominate on the gridiron. And we continue our series of Saturday Recovery, and it's a little misleading because of course, after a tough game on Friday night, you want to do these mobility exercises. I would highly suggest going all the way back and seeing our full body mobility one that we did week one. But we're going to just kind of dive deeper into each individual part. And quick reminder, if you are listening to this on a podcast device, click the subscribe button. If you're watching this on YouTube, click the little button down there, subscribe to our channel. It really helps. And then on all the social media platforms, please like, comment, share, retweet, all the things that you do out there. So we're bringing back in Dr. Nolan Clausen. He's a chiropractor and movement specialist at Elkhorn. MidwestMovementElkhorn.com is where you can find him. Now, we're going to talk about knee pain today, right? And interesting, in our building alignment series, our 7-part series we did in the off season, the knees were focused. But what we've come to realize is that the knee is a pretty simple joint, right? It's just a hinge, and it just goes forward and backwards, in and out. And so much of what comes with knee pain comes from the muscles and joints surrounding the knees. For linemen, we talk about keeping your knees in track to access all of your power, and then, of course, to keep them in line so they don't tear ligaments and do stuff like that. But give me your take on knees. I know you see guys that come in with knee injuries, and sometimes it's beyond repair, except for surgically, but oftentimes it isn't.
Yeah. It's kind of similar to like rotator cuff or like sprains and strains of the ankle, right? Although those two joints are completely different than the knee, like we said earlier, it just really hinges. It's kind of like the elbow, just moves and goes back and forth. But what we're seeing a lot is people are having knee pain, such as patellar tendonitis. They've been told maybe they had Osgood-Schlatters. Another serious one is they've been told that they have a meniscus tear. And some, they quite frankly are just not torn enough that they are operable, that they should have an operation. So there's some very simple things that we can do with the knee that make sure we can, 1, get that knee moving again, 2, bring down some of that pain, and then 3, let's build it up so that it tracks right. Like you were saying with linemen, we want to make sure that knee tracks like a knee, and it's not like, bending all over the place. So that's where the major ligaments kind of get into trouble, because they're supposed to guide your knee in this plane. And when we get out of that plane, those ligaments kind of, they've reached their limitation, basically. So when we do our full body routine, we do what we call cars with the knee, where we lay on our back and we push the knee up and we go around. If you do this, you can feel a good stretch in that hamstring. That's the first place I want you to start. I want you to just get some general mobilization in that knee joint, but also getting all the muscles around it to start working. Then you can spend a little bit of time, like say that hamstring was a little bit sore. Let's get our foam roller out and let's just massage it out just a little bit. Find spicy nuggets, spend a little bit of time through it. Now,
I got a quick question before you go any further. So of course the knee joint tracks, north and south. It isn't really meant to go side to side. Explain to people why you're doing like a little bit of a circle. So you are applying some rotational force there. To explain why that's important.
Okay, so if we know injury occurs when we get outside of the north and south movement, we want to be prepared for it. Basically, if we can control that motion that's going in and out, like using your own muscles, your own brain to move it in that direction. Now, if it gets pushed in that direction, or another person contacts it and it pushes it in there, the brain goes, "Oh, I know what to do when I get outside of just north and south," right? So a prepared joint or a prepared body basically is going to perform better or also understand what to do when it gets outside of its normal. This is to a T basically what Tom Brady's pliability
Mhm.
drills are. He practices or keeps his muscles loose and his joints loose and moves in those ranges of motions so that when he gets hit, his brain and his joints and his tissues aren't too quick to tighten up and try to freeze everything up. They know they've been there before.
Yeah, I know you're a, there's some neuroscience to that, of course. And I know
Yeah,
you're a huge, Gronkowski and Brady fan. So we'll move past that. But well, let's just say the guy's same age as me, who's been retired for 13, 14 years, and he's still playing
right.
football. So it
Yep.
has to work. So continue on. You talked about moving your knee around circles, and then of course you're going to feel some hamstring. And I've heard so many doctors just throughout my career and therapists and people tell me that so much of the pain from our back, our knees comes from tight hamstrings. So you focused it on hamstrings there. It's really important for your knee health to have good hamstring flexibility, right?
Yeah, it's I think maybe a little more overemphasized. I'm not a huge fan of just static stretching of
Mhm.
like, let's get the hamstring stretch. But I am a really good fan of like moving it through a range of motion or even just like I can feel a stretch in my hamstring there. Um, Static stretching is, like I said, static. You're not
Mhm.
static on the football field, so why would we practice it? Kind of a thing. So the other tissue that I want to practice or foam roll a little bit is what we call IT band, IT band syndrome. So you have a band that goes right here, it attaches to the outside part of the knee and is really thick tissue. Up here, you have two muscles, your TFL, tensor fascia lata, and then your glute medius that attach to that band and attached to the band that attaches to the knee, clear down here. So all day long, we spend our knees or our hips in this direction so that TFL, the one muscle that attaches, is short and tight, right? That glute medius is long and tight, underactive, right? So one of the things that happens is we get a ton of tension on the TFL side of that IT band. So we're going to want to try to massage it out a little bit. So we'll take that foam roller, we'll put it right at the knee. And I recommend doing this up against a wall because it is very tender and it
Oh,
can
that's
hurt
way
a
better.
lot.
I always do it with it on the ground, and I'm like crying when I get done doing it.
Yeah. So if you've never done this before, up against the wall, take that foam roller and go right here. And then I want you to bend your knee and roll, straighten your knee, roll. And like that is super tender for me. And then I'm somebody that foam rolls quite often. So you would do that both sides. And if you're crazy like Chris, you're going to lay down on the ground and do it. I'm guessing he does it quite often and he has no nerve endings.
Well, I had two hip surgeries, and
Yep.
this was a part of my life when I was a much larger man. But again, another, as we keep on alluding back to, is it feels like when you get that tightness there, and then you're maybe not going to be on track with your knees. So you're trying to
Right.
really loosen that up so your knees can operate the way God made them and the way they're supposed to.
Yep. So then the next thing, so we did our soft tissue. Now we need to get that knee moving. So what a lot of people lose motion in when they get knee pain is their ability to straighten their leg. When people have ACL reconstruction surgery, the first thing that they're trying to return back to normal is their ability to extend that knee. We
Mhm.
spend 90% of our lives sitting in desks where our knee is bent. We rarely get that knee out into full extension. This movement right here is what we do with 95% of our patients that walk into our doors that have knee pain. And it seems like witchcraft some days when all we're doing is extending that knee and we get tons of relief. So I like this one. One, if your knee is hurting today, but two, if you are on the sideline because you got hurt during a game, I want you to try this exercise out. And it's really simple. All you're going to do You're just kind of in this position. You're going to push that knee back. And I promise you're not going to hyperextend it. You can't physically hurt yourself. It's really hard. So you're just going to push that knee back. And I want it to lock out. I want it to feel a little uncomfortable when you get it back there. We want that full lockout of the knee. And you're just going to do like 20 or 15 reps. If this is too easy, just doing it like that, then you're going to go up against the wall. You're going to stand on one foot. Let's show this foot. And you're going to just push that knee back. Now we're loading it a little bit more. Okay? And our tissues love load. We want to load things as much as possible. Okay? So we got that joint moving again. It's going to feel a little wonky after you do that. The next thing, we already kind of talked about it. TFL, short and tight. So we got to foam roll the tissues to get them longer and looser. Now this glute medius, it's long and tight. It's underactive. So we take our band, and everybody has seen these. But basically all we're going to do is get into a squat or a good basketball position, and we're just going to walk side to side. And I want you to walk 10 steps one way, 10 steps the other. When you get to the end of 10 steps, I want you to do 10 squats with your knees tracking outward. Try not to let your knees go in like this. I want them out. It's going to get those glutes active. Okay? So those are really simple exercises. There's not a whole lot with the knee. I would refer back to our hip video or hip exercises if you have knee pain. We want to do these movements to address the pain, but we want to do those hip movements to make sure that knee pain, one, truly goes away, and then two, doesn't come back.
Yeah, and I love that putting the band around your ankle, because I got those same bands right here. They're sitting here on my desk somewhere. And when I train offensive linemen, I love to warm up and do like your steps and your pass sets, your zone steps with the band around your ankles or your feet. I got them right here. I got a whole pack of them right here, right? And I got them for you. You show me where to get them. And see, I believe that in doing that, you strengthen those muscles that keep your hips wide. And those are not very big muscles. And when we start doing them, the first time we do them, these guys are like, they start sweating and just doing pass sets, but those muscles get fatigued fast. And if you can strengthen them and of course do your routine of stretching and that, it's something that I did when I played football, and it was a huge help for me, help keep my width and my stance and stuff like that.
Yep. It's crazy the impact. I'll start getting a little bit of knee pain. I had a knee injury in college, and I'll go back to basically just what we do, and I'm like, it works.
Nice. Yeah, I know. An ounce of prevention, right?
Yep.
That's awesome. Okay, so you saw guys out there, you saw and listened to just how a lot of knee pain can be prevented, right? Someone falls in your knee, you have a tear, right? That's got to go get repaired surgically.
Yeah.
Isn't much you can do, but there's so much that goes on beyond that. And if you need help with this, MidwestMovementElkhorn.com is Nolan's website, and he's located out there in Elkhorn, right by Rick's Meats on 204th Street. And you can find him on social media, and all of his contact information is going to be, of course, included with this video. But Nolan, thank you so much for coming and helping us out today. We got just, a few weeks left of the high school season here, and these things start popping up. I'm sure guys just maybe are doing some preventative stuff, and then you have some knee stuff show up, and Andy and all of our routines will help them out, right?
Yep. We'd love to see you in here. We'd love to help you out. And then you can go get yourself a ribeye at Rick's Meats right after that.
There you go. There you go. Okay. Thanks everybody for listening. Reminder, if you're listening to this on your podcast app, click the subscribe button. Of course, subscribe to our YouTube channel where we have all of our videos. We literally have hundreds of videos, everything about football, especially O-line. And then of course, all the social media, follow, like, comment, share, retweet. And if you have any questions for me, you know where to find me, at Bober Academy on Twitter, we're on Facebook, we're on everything. And then, of course, Nolan out there at Midwest Movement. So, Nolan, thanks for joining us. We'll see you again next time.
Yep. Thank you, Chris.